Hi, everybody. I hope you can hear me. My name is Alex. I'm from Mitsar company. So we'll start this webinar tonight. And Olga V will make the presentation and tell you about the advantages and the reason why you need brain mapping in your practice and how you can use it, how you can apply it to your clients and show all the advantages of this approach. If you have any questions, feel free to post them in chat, and either during the presentation or right after the presentation, we will have time to answer the questions. And also I will publish the email. You can address your questions about the technique, about anything you are interested in. And now it's time for Olga to start our webinar. Have a good time, and I hope you all enjoy it and get some useful information.
Hello, thank you everyone for attending this webinar today. And my name is Olga V, and I am neurobiologist, a psychologist, and specialist in neurofeedback and functional brain diagnostics. I have quite long experience in this area, and today I would try to explain you why I think it's very important for us to have a possibility to look into the brain of our customers and how we can use this advanced technology in everyday practice. So first, I would like to tell you a little bit about background of this idea, and then I will also show you some real cases or real brain mapping analysis results from my customers. Then maybe you can find it interesting. If you will have any questions, please tell us about this in the chat, and maybe we can also discuss this a little later after this presentation. Thank you. So let's start. And today I will start with very basic things, because I'm not sure how deeply our participants know and how much they know about the brain, because basically many people come from different disciplines, especially to the field of neurofeedback or brain modulation, and some of them, they know quite well all neuroscience, and maybe for them it can be a little boring, but for others maybe they can find something new in this lecture. So you all understand that brain is our central control unit. Everything what we sense from outside world or from our internal organs, all this information going into the brain is analyzed by brain and controlled by brain. Of course, you all know that brain is a very complex and dynamic system, and that we can identify different structures in the brain. We have cortical, subcortical structures. If you go even more down, we have a specific organization of the brain at the layer level, and we have not only neurons by itself, but we also have glial cells, and they also have very interesting and complex interaction with neuronal cells, and so on. So on molecular level is also another question. So it's very complex, it's modular, hierarchically organized information processing system. And of course, it will be silly to imagine that I can explain everything in very short webinar, but at least I will try to give you some overview. So besides that we have different cortical, subcortical, and so on structures, we also can identify different zones in our cortical, in our cortex. And we divide the brain like prefrontal cortex, visual cortex, sensory motor cortex, and so on and so on. For example, Corbin Brodmann was studying the brain from the anatomical point of view, and he identified 52 different areas. And he defined these areas by cell density across layers, by what kind of cell types and what their size, how thick these different layers are. And he strongly believed that the different areas, they involved in different functions. And actually this is true. It was supported by many researchers. And until now, we still use the same logic that yes, we have some localization of functions. We have some visual areas that mostly involved in visual analysis of visual information. We have some auditory cortexes. We have attention system. We have system that process information on different levels. Also, it's not only that we have some cortical representation, but we also, our nervous system organized in a way that it's a network, right? So we have, for example, sensory systems that deliver the information from our senses into the brain, and they also have specific organization. Why I'm talking about this? Because sometimes if you are in real practice, you may have some customers who come with certain problems. And for example, with auditory system, like central auditory disorder, child may come and be presented with some attention deviation problems. Sometimes this type of kids may have some diagnostic, like they are probably autistic or something like this, but actually they have a problem at the sensory system, in the auditory system. Also, we should understand that depending on the level of the brain organization, the problem what we see and symptoms what we see is also related to where this problem is located. So if it's located somewhere at the very beginning of, let's say, a sensory system, for example, in the visual cortex, this person can lose the vision, right? But if the problem arises already on a different level, and it's about problems in the associative cortex, so probably this person can have some visual difficulties, but maybe it will be not so dramatic. Also, we have other type of brain circuits like motor circuits, associative networks, limbic networks, and so on. And all of this information is very important if we talk about brain mapping later on, and if we try to understand where these symptoms come from, because we need to present the best possible outcome for our customers. And of course, for this, we need to know a little more about what's going on in their brain. Of course, it will be, at least now we know that even though that every different cortical area involved in certain function, it doesn't mean that they work alone. So usually we have different type of networks and they are distributed around the cortex. Like in the resting state, our brain is not actually resting. We have so-called default mode network, which is taking care about many things. But as you can see in this picture, it means that there is different areas involved and they are really active during the time when we are almost dreaming. If we are doing some task or we need to perform, then we may engage other networks like executive control networks. We also have a sensory motor network that will taking care about our feelings, and a problem in this network also related with specific symptoms. Like I already told you, let's put it very simple. A visual network, which is, let's say, originated from the occipital areas, the disruption in this area can bring a really serious problem with vision. Or auditory network also can bring us some problem with auditory information processing. Dorsal attention network disruption will be found in people who have attention deficit disorder, etc. And for example, salience network found to be broken in anxiety, PTSD, Alzheimer's, schizophrenia, and so on. If we talk about default mode network, then we also find it in people who have sleep dysfunctions or PTSD, and so on. So as you can, why I'm showing you this picture, you will understand a little later, because we are talking about brain mapping. And every time when we see some deviation in electrical brain activity, we also can identify where this particular problem is located, which type of network involved in this pathological state. As I already mentioned, that our brain is modular and it's hierarchical and it's very complex. So we have interconnected networks on the in the very local space, and also on the long range. When I was talking about this distributed network, it's already about long range communication. Usually these networks, they involved in higher brain functions, but we also have more local systems. For example, if you talk about very fast brain waves like gamma, they involved very local brain networks. And if you talk about very low or slow brain waves, it means that they usually allows different distant brain areas to communicate. And also, we never doing just one thing. Like our brain is constantly changing, and we all the time adapt to the situation. So that means that we are all the time have some micro states. If we hear something, it means that some brain system engaged, because they need to understand what we hear, where it's come from, if it's danger or not, and it will change our functional brain state. It means we can have increased arousal or activation, and we will need to do some action if this sound or visual object is important. This is this work what our brain doing during this microstates. Usually the duration of these microstates, they are not so long. And then we need to come back to this resting state. And this transition is coming all the time. Many times during our day, we're changing, and we can be in different states. And these states is represented in electrical brain activity, or they can be at least found. And as you can see here in this picture, deep sleep will be associated with very slow frequencies in the brain or very slow processes in the brain. And let's say concentration will be related with a high activation, and on the electrical brain activity, it will be found in the form of very fast brain waves. Also, you can make an experiment. If you registered electrical brain activity with eyes open, usually you can't identify, for example, alpha waves in the occipital area in adult. But if you close your eyes, normally you should have alpha waves in the occipital areas. And this is exactly about how our functional state change. So when we talk about brain diagnostics and what we need today, of course, we need non-invasive, we need something affordable, we need something user-friendly diagnostic tool, some possibility and some tool that can tell us what type of protocol, what type of approach we can use for our customers. Also, we need something that allows us to distinguish between different patients. Today, what we have fMRI. It's possible also to identify some functional brain state. We can use MEG, we can use some other technology, but they are quite expensive, and not every psychotherapy clinic can have it. But EEG is quite affordable. It's possible to use it. It's easy to learn how to use it, and with proper software and hardware, you can add it to your practice in very short time. What's the difference if you talk about registration of the electrical brain activity and using, for example, quantitative analysis or mathematical analysis of EEG, because EEG known for years, for decades, and it's used in neurological practice every day. There is nothing, let's say, super new in EEG. But when we talk about quantitative EEG analysis, it exactly allows us to see all this communication between the different brain areas. And this is very important in the modern diagnostic approach when we understand the disruption at any level of the system can bring some problems and can be related to a specific symptom. Let's say we have some EEG, and usually if you are in a neurological setting, you can do some visual analysis. And normal EEG looks, let's say, like this, but pathological EEG may be presented with some spikes if the person has epilepsy, and we call it then pathological signs. And this is more or less all what we can do with visual EEG analysis. But if we talk about modern technology and QEEG, that, for example, can be done by MITSAR software and hardware, we can produce, we can do a lot of things. Besides that, we can register normal EEG in resting state. We can also do long-term analysis. We can measure EEG during sleep. And more, we can also do some artifact corrections, because people moving, they can blink, they can have some muscle contractions, and this is all, of course, make it complicated to analyze EEG signal. But with our software, it's very easy to denoise this recording, and then we can do some processing. Like, for example, in this picture, we can identify spikes automatically. We can also look where it is located. We can identify the site and even make 3D mapping of this area and understand where exactly this problem is located, and how this can be related with symptoms. If you remember, I show you at the beginning of this lecture, this Brodmann areas, which is related with specific functions. And usually when we identify the site of pathological condition or site where the pronounced deviation is located, then we can also identify at which Brodmann area it is located and look what kind of functions this area involved in. So we can support, let's say, some symptoms that our customers sometimes talking about. Besides that, we can do some of mathematical analysis of EEG. I will not go today very deeply into this into discussion about how we do it and what it means, but let's see how we can use it. So we can create so-called maps of electrical brain activity, and this is power spectra. This is one type of presentation of EEG that you record from your customer. And if you look at this picture, you can, let's say, here is the ears and nose. So this is the different electrical activity on the scalp, on the surface of the brain. And because we do not record from electrode placed on the scalp any activity from deep structures, but we can identify what's going on the cortical areas. And in this case, we can see that it's quite a lot of alpha activity, this yellow. It's alpha activity distributed on the scalp. So what we can do next? Next, we can compare this data with normative database. And human brain index reference database was created specifically to help the clinicians and practitioners to understand what is the difference between EEG of the customer or patient and normative population matched with the same age and the same sex and so on. So when we talk about this comparison and why we're doing this, actually, more or less, if we talk about general brain organization, besides that, it's very complex and dynamic and not so easy to understand, but still in most of the people, organization of the brain is more or less the same if they are healthy. And the same can be true for brain activity. Even if we measure it with fMRI or we measure it with EEG, it's going to be more or less the same pattern of activity in normal situation when people, they are not suffering from any neurological or psychiatric diseases. So we can, therefore, we can identify specific patterns of activity, and we can also use database where thousands of people included as a reference. Let's say why we also use this logic, because if you're doing a blood test and let's say you have some elevated leukocytes, it means that it's not just some one point, but to some degree, your parameters are different from the normative parameters. So somebody already measure what should it be. So how many leukocytes can be in this person in this age? The same is with in other medical examinations. So we always have some norm situation, healthy people, and people with some specific symptoms. Here is completely same idea. So when we compare EEG of the person without any problem and presented with certain symptoms, we can identify the deviations, and it's already statistical comparison. I don't go again to very deep mathematics, but you can see these black dots. They explain that these areas, they are not working properly. So here is some deviation from normative database. It means that if we look a little deeper, we can understand what type of symptoms and can we support them. Why I also so many times refer to the symptoms. Actually, symptoms, they can be very broad, right? And they also non-specific. Someone come to you and telling that they suffer from insomnia for years, and they try to use whatever medication, but nothing help. And then when you look into the brain, you can find that they may have not even exact insomnia, but some other, let's say, neurological process. They have some epileptic focus, or they may have some other deviation. And in this case, you can recommend them to visit another specialist, for example. Also, the same is with attention deficit disorder, which is now looks like pandemic. Whenever you met someone, they telling you that they have ADHD, and I hardly believe that everybody has ADHD. So probably people have something else. And it's also possible to use brain mapping to support or maybe be a little bit concerned about current diagnosis. Sometimes you also may face with situation when person telling you that nobody believes that he has this symptom, and you can look into the brain mapping and again support or be disagree with this statement. For example, how it looks in ADHD and depression, how they are different. In case of ADHD, we can find that a person has down-regulated frontal areas in the brain. They may have some low frequencies also in central areas, especially if they have impulsivity. They can have some heightened communication between the side if we measure coherence. But in depression, the picture will look a little different. So again, we have some deviation in frontal areas, but distribution will be different. And if we do a little more precise analysis, we can identify which area of the brain is suffering. And you can see that there is clear asymmetria between the right and left hemisphere. And the same also, we can look in the communication or coherence in the brain mapping, and to support or disagree with the idea, or maybe to suggest specific treatment algorithm. For example, we can talk about neurofeedback, or we can talk about transcranial magnetic stimulation or something else. And in this case, we can also identify the site of interest for the future target. When we talk about attention deficit disorder, there is 3 main subtypes: combined, hyperactive, impulsive, inattentive, and they all have specific brain activities. Besides that, it's also not rare when people with ADHD and with some other problems, they presented with epileptic focus, or at least with some pathological activity in the brain, but nobody ever measured their EEG, or no neurologist look into the situation with this client. And for example, this boy had attention and behavioral problems, dyslexia, but actually has clear focus in his parietal areas. And this area involved in a default mode network, in cognitive and emotion functions, in language functions. So it wasn't a surprise that he has some sort of dyslexia. Another attention deficit person, 15 years old, has clearly down-regulated frontal areas, some problem in the parietal network, and also emotional reactivity, which is telling us that there is some limbic system involved. And if you look into the maps and in the comparison with normative database, you can see that it's clearly deviated from norm. If we talk about Asperger syndrome, this is also quite interesting because these people often can have overactivated frontal area. And they also presented with inattention and impulsivity, and sometimes they have some dyslexia. So we can identify which networks in the brain affected and suggest specific neurofeedback or neuromodulation protocol for like transcranial direct current stimulation or RTMS or whatever. But at the same time, when we talk about differential diagnostics, it's another person with Asperger, and he has little different problems and different distribution of deviation. So in his case, most of the problem there was located in one hemisphere, and he has also dyslexia, but it looks totally different from the previous person. So the location and the training site will be different in this case. But again, overactivation with different frequencies. This is also a benefit. We can also identify the frequency. If you talk about neurofeedback, which frequency we should train. Insomnia. Insomnia is also a pandemic because this type of problem can be, as let's say, additional symptom to almost any psychological disorder or psychiatric disorder. And if you talk about people who suffer from insomnia for many years, and they clearly have a diagnosis of insomnia, they was in all-night monitoring analysis. Usually they have some deviation in the fault mode network. Very often they also come and they talk that they have some attention problem, and sometimes they even got ADHD diagnosis. I don't know why, but it's come from the fact that they have some deviation in the parietal areas, and so we can try to help them to improve by providing specific training protocols. Anxiety is also very often a problem that a clinician or practitioner or psychologist and psychotherapist have to face with. And here is also quite heterogeneous population. Like this person has anxiety and depersonalization, and you can see that it's very, very high activation of the cortical areas. Totally opposite with attention deficit disorder. But trust me, this person also told me that she has a attention problem because of the overactivation. In this case, we can say that, and we can see that she has some problem in the fault mode network. It was hard for her to sleep. Some problem with a salience network, and memory, it was also affected, and so on. Bipolar disorder, again, with attention, emotion regulation, also have a specific brain pattern of activity. And for example, in parietal areas, we have simultaneously overactivated and down-regulated peaks, like we have alpha and beta, excessive alpha and excessive beta. So we need to find some protocol that will address specifically problem that was related with this with his symptoms. Yeah, it's also possible that you may have some clients with some traumatic brain injuries or stroke. And in this case, functional brain mapping also can help you to look into the problem and to see what's going on in the brain. And this person has motor execution problems, spasticity, significant language problem. So we need to take care about areas that was involved in this pathological process. And again, by identifying the site of interest, you already can target the specific areas to help your patient effectively. Besides quantitative EEG analysis, it's also possible to look into the stages of the information processing in the brain. So until now, I talk only about general activation in the brain in the resting state. But also, it's very important to understand how we process the information. Remember, at the beginning of this presentation, I show you some sensory systems, right? Some visual system, auditory system, motor system, whatever, sensory motor system. And here we can look how the brain can process the information. And if already at the beginning of information processing, let's say we see some picture and we couldn't identify it properly, or some part of this picture is not visible for some reason because the brain areas they was seriously affected because of concussion, let's say. So then following processing of the information can also may not be so perfect, or you may have some mistake, right? So we need to understand what's going on in the brain. And for this, we use so-called event-related potential recording. We still record electrical activity from the brain, but in this case, our clients, they need to press the button or maybe do any other test. And then we can calculate and understand how brain process this information. Also, we can later compare these results with the normative database and to see if there are any differences and any deviations. Sometimes we can say that in people with some people, they can have problems with functional brain states and with quantitative EEG, but they totally normally process and manage, process the information and manage in everyday life. But some people, they may have really mild deviation in QEEG, but very serious deviations in ERP and or event-related potentials or stage and information processing. And it's really affect their life because they can't perform in the best possible level. And the difference between QEEG and ERP is so that QEEG reflect cortical self-regulation, overall mental state. We can see if this brain is alert or drowsy, and we also can assess to some extent brain homeostasis. But if we talk about ERP, it's about cognitive and executive functions. And here's the example. For example, person with ADHD can have some problem in processing information in the visual system because he's a little bit overactivated, so he has some impulsivity. He may react too strong to some visual cues, to some visual information that is coming, and therefore this green wave is has higher amplitude than this red wave. Red is normative database and green is patient. The same with Go component, which can be different in patient and in normative database, or no-go when you need to suppress unnecessary unnecessary response. That is, if you ever see the people with ADHD, if they want to take something from the table, they will do it. Even they understand they shouldn't, but they couldn't stop this prepared action. So the impulse immediately go into the resolution, so they try to grab something. This is exactly about no-go process or suppression of unnecessary action. And it may not be only motor responses, can be some words or some vocalization or something else. Also, abnormal information processing can be found in Asperger syndrome or in autism, and they can have little different type of deviation, but still they will be significantly different from normative population. Anxiety also have a specific pattern of activity, and people who have high level of anxiety, they perceive the world a little differently. They may have so-called sensory hypersensitivity. Also, actually, people with Asperger, they also can have some hypersensitivity of sensory system. Also, people with anxiety may react too strong to some unexpected stimulus because their brain like overactivated and ready to look into the threat around in environment around them. And of course, it's affect not just basic information processing, but also higher brain function like monitoring, like working memory, and so on. So how we can use and why we need all this brain mapping technology. Yes, you can do some visual inspection of EEG, and you can see if there is any abnormal activation. And if you see something already in this stage, you can recommend your customer to visit other specialists. We can identify and map pathological activity, understand where it's located, and find a connection between the symptom and the problem, because we know where it's located. We can also make some comparison with the normative database and understand to what degree your patient is different from the normative population. And also we can measure event-related potentials and understand better what this person may need in terms of training. Then we can also recommend them some pharmacological treatment. I mean, not we all, but medical doctors, they can recommend some medication. And actually, this mapping allows clinician also to support some ideas about what type of medication can be used for a particular client or particular patient. We can recommend some forms of psychotherapy for different people. We can use neurofeedback protocols, or we can do some precise brain stimulation or brain modulation with different techniques. And here is just some example of what's going on and how you can use actually this brain mapping analysis to confirm your clients about the results. Because sometimes people, they don't feel, or they may feel something, but they are not sure. And if you're making QEEG and or ERP or both, you can show them the real results. And for example, this 13 years old ADHD person had improvement in both QEEG and ERP. Also, another person with ADHD, they had some improved components of some improvement in information processing and behavioral control. Okay, so I will thank you for your attention, and I hope it was informative and you get some more information and some kind general understanding what it is, this brain mapping. And now I can answer to your questions. I can see that we have some in chat.
Yeah, hello, Olga. I hope you can hear me well. So yeah, we had a few questions. So one of the I like more is about the Atlas or EEG Atlas. There's some kind of paper with EEG patterns. So I know there are quite a lot of EEG pattern atlas available, but they're mostly related to epilepsy and other neurological disease. But I'm not sure that we have a clear atlas of including FFT power spectra, brain mapping, and other QEEG techniques. So maybe you can suggest something, because I have responded that that's why we're using normative databases, because we can compare our patient data to some reference database and get the deviations in power spectra, in event-related potentials, in independent components, and also evaluate the statistical significance of these deviations and work with them. But it's important to know what does this deviation mean. So we may find out that we have excessive alpha or some wrong beta distribution, but we have to understand what does it mean and how we can work with it.
Right. I'm not sure about this brain atlas, what the people mean, because what I know, the most existing for medical needs, they are more about this visual EEG processing and something completely medical for medical needs, for clinical use. And they don't use so much QEEG. And especially they don't use a normative database comparison. Unfortunately, it's still, let's say, at the beginning. So we do have some approval from FDA, but it's not yet a routine practice in medical setting. So I don't think we can find exact maps or some atlases about this stuff.
Okay, so we have to use our own experience and normative data. Am I right?
Yeah. Yes, yeah. And of course, we can always refer to the PubMed and publications from our colleagues who are all the time working to add to our knowledge about the brain and to the disease, to symptoms, and so on.
Okay. Okay.
But it will be perfect to have it.
Okay. Thank you. Yeah, because there are atlases in EEG pattern, pediatric and intensive care units, and epilepsy using special about the spikes and sharp waves about different kind of epilepsy. But unfortunately, we don't have this kind of handbook for QEEG and for such deviations like hyperactivity and attention deficit and many other disorders people suffer. So
now I found this question actually. It was about Brodmann areas.
Brodmann areas. Okay, right.
Different structures. So yes, some information about Brodmann areas exist in the internet. And I think you can just find it very easily just by typing Brodmann areas. And there are plenty of different resources that telling more or less same things. They are real, they exist, so it's possible to look at them. And of course, this type of atlases, they exist. I don't remember now by heart, but if I find, I can send, of course, some link. Because, you know, for example, neurosurgeons, they need it all the time. They have to deal with patient, and if they need to do some operation, they do some pre-operative mapping exactly for this reason, to understand which function can be lost or which function can be affected during the operation. So yes, they do know something about Brodmann areas. Even more now, it's more developed, and there are different atlases, not just Brodmann exist. But this is already a complicated topic. But thank you for the question. Mm-hmm.
Maybe you can show us one of the real QEEG reports, of course, without the real patient data. Maybe you have some kind of sample, how you usually process the EEG, and what kind of information you could find in some real case from your practice, if it's possible.
I can try to find something, but
no, that's okay. So we can email to the people if they want to.
Yeah, I can also, if somebody interested, I can just send some example how it looks like.
Okay. Would you mind to put your email address in chat that people can ask you about?
Yes.
The questions and maybe request the report sample and something like that. So I think it will be useful.
Okay. This is my email, so please, if you have any further question, I will be happy to answer.
Maybe one more thing is if you can suggest some books to read about brain mapping and QEEG, it's good to know about that.
Yeah, there are at least two books that was written by Yuri Kropotov, and also other books exist. Alex, maybe you have now this information or link to this book.
Yeah, I can. The Yuri's books are available on Amazon, so basically I can post links. but there are a few publications as far as I remember on EEG. For
Yes,
example, Rivi just suggested us the book, The Human Brain book by Rita Carter. So
yes, yeah, right.
okay, guys, if you don't have any other questions, that's fine. If you want to ask Olga something by email, so the email is on chat now, so you can use it and to request a report sample to get more, better understanding how you can use what kind of data you can find out in patients in your customer's EEG if you run your own practice. I mean, and so this was some kind of introduction webinar, so where we just told about what brain mimic is and how we can help to evaluate the brain functioning. But we will do something more advanced. So going deep in QEEG, event-related potential and related topics. So we will announce next session very soon. So stay tuned. And again, feel free to ask questions either in Facebook or by email. Thank you, everyone, for coming and spending your time. The webinar has been recorded, so we will publish it on YouTube, and you'll be able to find it on the internet. So thank you.
Thank you, everyone. And I hope this was interesting, and I will be happy to answer to your questions. So please do not hesitate to ask. And welcome to our future webinars. Thank you.
Thank you, guys. Have a good day, the rest of the day, and see you next time. I hope you found something interesting. Cheers, guys. Enjoy your day. Bye-bye.
Bye-bye.